So my presentation is on a diabetic patient. Uh, my patient was a patient I took care of about 3 months ago. Mr. JS is a 59-year-old Hispanic male. He's considered low income and is currently covered by Medi-Cal. He has a strong support group that includes his wife and daughter. Description of chronic illness. Mr. JS was diagnosed with diabetes 5 years ago. He stated that he does not see a primary care doctor regularly. For that reason, he most likely has been a diabetic for much longer. He was admitted to the hospital due to complaint of left foot swelling and pain. He was diagnosed with cellulitis of the left foot with suspected osteomyelitis of the left great toe. He waited so long to be evaluated by a physician because he had no feeling to his toes, secondary to neuropathy, so he did not see the urgency in seeking care. He was then placed on Ancef 2 grams IV every 8 hours for 42 days total, and also for dressing change to the left great toe with normal saline and dry dressing daily. And notify the MD of any increase in redness, drainage, or pain. Primary nursing intervention was to teach the patient the importance of managing his diabetes at home, caring for his feet, and seeing his primary care doctor regularly. Description of self-care and self-care management capacity. Once Mr. JS is discharged home, he will be able to perform some of his own ADLs. He'll be able to feed himself, brush his own teeth, comb his own hair, and dress himself. But since the patient should only be weight-bearing for 5 to 10 minutes an hour, it'll prevent him from cooking his own meals, going grocery shopping, driving, and working. Before developing the diabetic ulcer on his left big toe, he worked as a full-time truck driver. He will now need the support of his family and possibly from disability insurance. The patient's wife has been taught how to perform the daily dressing change to his foot, and a home health nurse will be visiting the patient at least once a week to monitor the wound. Because the wound is on the dorsal part of his toe, the patient is unable to perform his own dressing changes. Patient pattern of health care utilization. Mr. JS seemed proud to share the fact that he had not seen a doctor for more than 20 years before recently being admitted to the hospital. He stated that he was a healthy man with no medical needs. What else? He should be educated on the long-term effects that diabetes has on the body. He didn't seem to understand the correlation between his uncontrolled diabetes and the length of time it is taking the wound to heal. He said that the reason why he went to the hospital is because he noticed his toe became swollen and because he noticed drainage on his sock. It seems like he didn't think the infection was that serious, and since he wasn't experiencing a severe pain. He did mention the doctor advised him to check his feet regularly, and he is now familiar with the reason why he wasn't feeling much pain. Mr. JS had no idea he had diabetes prior to being admitted to the hospital. He did not receive any kind of home health. Once discharged, he should see his primary care doctor so that he can continue to monitor and refer him for any specialist if necessary. NCM patient level strategy. Patient is compliant with his diabetic heart healthy diet. He is cooperative with care to include daily dressing changes. He is actively involved in his care by monitoring his feet frequently and following doctor's orders for weight-bearing status. He has been actively engaged in learning about his chronic condition to include diabetes. The NCM partnership clinical has been an active part of his care. The patient has been scheduling his own follow-up appointments with his primary care doctor. NCM system level strategy is education has been an important strategy used in treating Mr. JS. The nurses have been instructing him how to monitor his blood sugar before meals and at bedtime. They have been teaching him the correct method to use a glucometer and the importance of hand hygiene when caring for his diabetic ulcer. He will need a home health nurse to continue monitoring his condition and to continue teaching pertaining to diabetes. And that's it. Thank you.